Welcome to Triarch Health's MIPS training for CMS measure number 66, Functional Status Assessment for Total Knee Arthroplasty. Let's take a look at the details of this measure and then I'll illustrate the most appropriate workflow. This measure takes into account patients who are aged 19 and older who have received an elective primary total knee arthroplasty and completed a functional status assessment within 90 days prior to the surgery and in the 270 to 365 days after the surgery, and also patients who had an outpatient encounter in 2022. Patients will enumerate with a patient-reported functional status assessment. This includes the RAND-12 survey, Promise 10 survey, and the CUES survey. Again, this all needs to happen in the 90 days prior to the total knee arthroplasty procedure and in the 270 to 365 days following the procedure. Please note that the same screening tool must be used both pre and post-procedure. And likewise, this measure does meet CMS's high priority requirement for 2022 in the quality category. We would also like to remind you of some key elements for this measure. Patients can be excluded from this measure when they have 2 or more fractures indicating trauma at the time of the total knee arthroplasty. Patients can also be excluded when they have severe cognitive impairment that starts before or in any part of the measurement period. And finally, patients can be excluded when they have been in hospice care for any part of the measurement period. You'll notice today that I'll be demonstrating using the screening tool's CUES survey. But please note, for other measures that your location may be utilizing for the 2022 performance period, to increment any measure using the history module, the occur date must be entered. If exam notes are not coded with the appropriate diagnosis and CPT code, patients will also not increment. And finally, if your practice would like to use an alternate SNOMED, LOINC, or ICD-10 code than what you see in this demonstration or in the quick guide, please reach out to support for options. Let's move on to the demonstration. This patient has already been identified as needing a knee arthroplasty. We need to first document the FSA in the 90 days prior to their knee arthroplasty procedure. So first we'll navigate to Go, Screening Tools, and for the purpose of this demonstration, I'm going to select CUES Knee Survey. From here, I'll select the appropriate provider information, and since this is taking place before the knee arthroplasty procedure, I'm going to select pre-surgery, as well as the other detailed information for this patient. And then finally, I'm going to select the day in which my patient is taking this functional status assessment. Again, this needs to be done in the 90 days prior to their total knee arthroplasty. But for the purpose of this demonstration, I'm just going to select today's date. Once the patient has filled out this information, you will hit Submit Survey. The pre-surgery survey has now been completed for this patient, and you can double check this by navigating to View, Screening Tools, and I can see here with the corresponding date and timestamp that this CUES survey did take place. I can then continue on with the rest of my office-specific workflow. Now let's fast forward. Let's assume that the patient has now received their total knee arthroplasty. That procedure will be documented in patient history with the occur date or ICD-10 code with the appropriate coding information. In the 270 to 365 days after their procedure, we need to document the post-procedure survey. So again, we'll head up to Go, Screening Tools, and I will select the CUES Knee Survey once more. I'll enter in the provider information again, and I'll make sure to note post-surgery and the occurrence for the survey. This again dictates that this survey took place after the patient received their knee arthroplasty. I'll adjust my date to when appropriate, and once my patient has again entered in all of this information, we will submit this. And just like the pre-survey, we'll be able to double check that the post-survey was in fact attached to the patient by navigating to View, Screening Tools. And here you can see both of the pre and post surveys have been applied to this patient. At this point, you may then continue on with the rest of your office-specific workflow. And that's all you need to do to enumerate a patient for the total knee arthroplasty measure. Thank you for taking the time to watch. Please refer to the corresponding quick guide for additional details on this measure, and please reach out to us for any questions you may have.